and the second group is hallucinogens, right? So psychomotor stimulant or hallucinogens, right? So these are the two major group. You know, hallucinogens basically, there are false perception. Basically, hallucinogens means false perception, and this false perception may be of related to voice hallucinogens, verbal hallucinogens, visual hallucinogens, and even the smelling hallucinogens. So there are different variety, sensory different variety, that false perception, right, that occurs in hallucinogens. And this false perception may be of different type, like I told you, the verbal hallucinogens, and what we have discussed, right, speech hallucinogens, false perception related to visual activity, false perception related to false smelling activity. Clear? So this is a broad group, but we are not going to discuss in very much detail, but we are going to discuss the few compounds, few drugs that can cause this false perception problem, which are labeled as the hallucinogens. So psychomotor stimulant, that will causes excitement, euphoria, decreased feeling of fatigue, and increased motor activity. So what you can recall and what you can correlate with all these activities, if anything, and you are going to anticipate, if you are anticipating that this compound or this drug is going to produce excitement, is going to produce euphoria, feeling of well-being, and feeling of immense pleasure, and the person feeling like I am living, I'm flying in the air and living in a fantasy, and decreased feeling of fatigue, what it will do. And these are the activities which are responsible or which may cause the development of drug addiction. So if anyone anticipated feeling that, okay, this will cause me excitement, this will give me euphoria, and it will enhance my motor activity, so I can perform the activity more than normal, right? So this compound and these properties may lead to the development of drug addiction, right? Okay, when we talk about the drug addiction, we must know the terms, like we must know at least two terms, right? One is the psychological drug dependency, and another one is the physiological drug dependency, right? So dependence means, and this is called drug addiction, right? Or when it's going to develop due to these characteristic features, to achieving, to gaining all these characteristic features which are anticipated. So a time comes when patient may be dependent of that drug, right? So totally dependent on. So what will happen if a person is totally dependent on that substance or on that drug? If that person is not going to take that substance or that drug, what will happen? There will be withdrawal symptoms, right? Or we can say there may be a development of abstinence syndrome, right? But there is a slight difference. If I'm going to ask, okay, which drug dependency is dangerous? Psychological drug dependency or logical drug dependency? Which one is dangerous? Okay, there is a reply. physiological drug dependency is dangerous, right? Because if patient develops physiological drug dependence, that means there is a change at the molecular level. Now the body will show the reaction. That is, now the withdrawal symptoms are produced when the body is going to show the response in the absence of that substance. So that is called the physiological drug dependency. That is not under the control of that person. But in psychological drug dependency, body is not going to show the response. Okay, mentally there is a feeling of craving, there is a feeling of irritability. So these are the problems that can occur. But body is not going to show the response like palpitation, like tremors, like sweating. So all these problems, they are not going to develop in psychological drug dependency. In psychological drug dependency, just feeling of craving, just feeling of irritability due to the absence of that substance. The key example, in our society, some of us are addict of taking coffee, addict of taking tea, even tea, or and the best example is the smoking. In smoking, usually if that person is going to stop smoking, what will happen? So craving, irritability, psychological dependency. Because if a person having a strong will, that person can quit smoking. And to avoid the irritability or craving, that person can also be prescribed nicotinic gum, and there are some drugs that can suppress that craving. But that is under the control. Body is not going to show the response. The similar example, like taking, if a person having a habit of taking coffee 3 or 4 cups, so if that person is not going to take that coffee or tea, so what he or she will complain? They will complain, okay, I have a headache, and they show some irritability. So this is called psychological drug dependency. That can be controlled, just except there are few irritability or a craving sensation. Otherwise, body is normal. But in physiological drug dependency, now body is not under your control, under your will. That will show the response. Clear? Okay, hallucinogens that will causes profound changes in thought patterns that I have already discussed. The false perception can occur, right? And there is a change in the mood, right? And why a person become addicted or dependent on this hallucinogens? Because initially a person taking that substance just to elevate his or her mood, right? But in the continuous use, it can disturb the thought pattern as well. Okay, I think it is the more than enough explanation. Now, one by one, psychomotor stimulants. Now, here you must know the examples. What are the drugs and what are the substances which are including? Okay, methylxanthine, one of the important group, major group, and one of the substance that we are taking from this group, and in our daily life, caffeine or coffee, that belongs to this group, methylxanthine. Nicotine, right? And this is one of the commonly used substance, especially if a person who are a smoker, right, or chewing nicotine, tobaccos, right? Cocaine, amphetamine, and methylphenidate. So these are the different substances or drugs that are labeled as psychomotor stimulant. Clear? Okay, now already we have discussed the examples of psychomotor stimulant. Now the mechanism of action. Methylxanthine, how they are going to produce its activity, it will inhibit phosphodiesterase enzyme, and it also block the adenosine receptor. If you have done the treatment of asthma, if you just try to recall, okay, methylxanthine, and one of the important example of drug that belongs to this group and that can be used in the asthma. Can anyone recall the example of that drug? Can anyone recall the example of that drug that can be used in the treatment of asthma, as a prophylactic treatment of asthma, and that belongs to methylxanthine group? So, okay, there is a reply, theophylline, right? So, this drug, methylxanthine or theophylline, they are going to inhibit phosphodiesterase enzyme, which is responsible for the breakdown of cyclic AMP. For smooth muscle relaxation, the level of cyclic AMP is required. So if phosphodiesterase enzyme will break down the cyclic AMP, the level of cyclic AMP will decrease. And this group inhibit this enzyme, so there will be no breakdown of cyclic AMP. The level of cyclic AMP will raise. And this cyclic AMP is also responsible to produce mental alertness. This is important. Mental alertness. For mental alertness or activity, high level of cyclic AMP is required, right? So this is one of the possible mechanisms that we can correlate with psychomotor stimulant. And this blockade of adenosine receptor activity, that is especially more linked with asthma, because adenosine is a powerful bronchoconstricting agent. If we block this adenosine receptor, so we can avoid the bronchoconstricting activity. Okay, nicotine, but this activity is not related with the psychomotor stimulant activity, but inhibition of phosphodiesterase enzyme activity, that we can correlate with the psychomotor stimulant activity of methylxanthine, because cyclic AMP level is required for the mental alertness, mental activity. So this group inhibit the phosphodiesterase enzyme, which is responsible for the breakdown of cyclic AMP. So this is how we can raise the level of cyclic AMP. The second one is nicotine. I think every one of you know about this nicotine, because smoking is one of the common habit all over the world, not in our country, not in our setup, but all over the world. So in low doses, this nicotine causes ganglionic stimulation by depolarization. And at high doses, it will causes ganglionic blocking activity. So we can say the initially nicotine is going to produce stimulation and followed by depression. And this is the logic, you know, why a person who is a chain smoker or habit of smoking, he lit a cigarette, and after 5 or 10 minutes, it's variation is there, and depends on the continuous use and how much use of this nicotine. So after completing or finishing one cigarette, and after, in some person, within 5 minutes, after 5 minutes he or she is going to lit another cigarette, or in some person after 15 minutes there is a craving. And this craving, right, for lighting another cigarette is due to depressive activity, right? So just to get stimulation, again they are going to lit another cigarette. Cocaine, blockade of reuptake of monoamines. You know, monoamines or different neurotransmitters, they are released, and come into the synaptic cleft and act on the postsynaptic receptors and produces its activity. So before discussing this mechanism, I think all of you have done the antidepressant. When depression is developed, when depression is developed, when there is decreased level or increased level of amines. Depression is developed when increased level of amines or decreased level of amines. Decreased level of amines, right? And we have different amines like catecholamines, in which we have norepinephrine, 5-hydroxytryptamine, which is also called serotonin, and dopamine. So these are the amines, and they are responsible to produce stimulating activity. So how we can raise the level of these amines? If we block its reuptake, right? Reuptake for recycling phenomena, so the persistent level of these amines would raise in the synaptic cleft. So cocaine, this is how it's going to produce its activity. Now this amphetamine, this is another very important compound, very important drug, right? And it's being used in our society as well, that we will see how. Increase the release of intracellular stores of catecholamines. Again, for getting excitement, for getting neuronal activity or stimulation, the role of amines is very important. The purpose of getting a stimulation, increase level of amines. So amphetamine increase the release of intracellular stores of catecholamines. So that will reaches in the synaptic cleft and produces its activity, and also inhibit monoamine oxidase enzyme. So what will happen if we inhibit this enzyme? Because this enzyme, monoamine oxidase enzyme, is responsible for the breakdown of these amines. So if we inhibit monoamine oxidase enzyme, there will be no breakdown of amines, so the level of amines will raise. Like high level of catecholamines are readily released into the synaptic space. Methylphenidate, this is dopamine, specifically dopamine transport inhibitor, and may act by increasing dopamine in the synaptic space, right? Varenicline, this is very important drug as far as the BCQ is concerned, because this varenicline, a partial agonist at neuronal nicotinic acetylcholine receptor in the CNS, and this is one of the drugs that can be used in a person who are really interested to quit smoking or to stop smoking. So this varenicline, having a partial agonist activity at the neuronal nicotinic acetylcholine receptor, so it, by using this varenicline, can avoid the withdrawal symptoms due to quitting of smoking, right? So this is one of the drugs that can be used, varenicline. Now the therapeutic uses, methylxanthines, caffeine, this already we have discussed, and its derivatives relax the smooth muscles of the bronchioles, right? Nicotine, not currently used therapeutically except in smoking cessation therapy, like using nicotinic gums, nicotinic transdermal patches, right? Local cocaine, local anesthetic action, and applied topically during eye, ear, nose, and throat surgery. If you just try to recall the lecture related to local anesthetics, okay, we discussed, or we told you that this is the only local anesthetic that produces vasoconstriction, right? So the only local anesthetics that can produce vasoconstriction. So we can clean the field or operative field, because when there is no excessive bleeding, there will be definitely a clear field to operate. Amphetamine, what are the important conditions in which amphetamine therapeutic uses, clinical uses, right? Because there are some drugs like amphetamine, this amphetamine and its different derivatives are being illegally, that we will discuss. So legal use of this amphetamine is one of the legal use is in ADHD in children. What does it means, ADHD? If anyone can tell me. ADHD stands for ADHD stands for, okay, there is no reply, no problem. Attention deficit hyperactivity disorder in children. ADHD is the attention deficit hyperactivity disorder in children, right? Because in children there is a problem. Hyperactivity is due to because they cannot concentrate for any activity for more than 5 to 10 minutes, right? And second important condition is the narcolepsy. You know, this is a chronic sleep disorder, right? Characterized by overwhelming daytime drowsiness and sudden attacks of sleep, right? So this is one of the problems. So these are the two important problems in which we use this group amphetamine legally, right? Then another derivative of important derivative of this amphetamine is the methylphenidate. Again, the same use. And varenicline, this also we have discussed, useful as an adjunct in the management of smoking cessation. So these are the key points that from you students' point of view, you must remember, right? Now the adverse effects. We are discussing the psychomotor stimulants and important substances. We have discussed the examples, mechanism of action, right? Therapeutic uses. Now adverse effects. Methylxanthine, moderate doses of caffeine causes insomnia, anxiety, and agitation. But high doses causes emesis and convulsions. Lethal dose, which is 10 gram of caffeine, induces cardiac arrhythmias. You know, 10 gram caffeine means if a person is going to take 100 cups of coffee, that is not possible, right? So I think this is sure that person is not going to take 100 cups of coffee, which is a lethal dose, and that can cause death due to cardiac arrhythmia. But lethargy, irritability, and a headache occurs in users who routinely consume more than 600 milligram of caffeine per day, and it's roughly 6 cups of coffee per day, and then suddenly stop. Then it may show some irritability, and you can say withdrawal symptoms. Nicotine, CNS irritability and tremors, and also cause intestinal cramping, diarrhea, and increased heart rate and blood pressure. Cigarette smoking increases the rate of metabolism for a number of drugs. This is number of drugs, and this is very important point. That means if a person is chronic or chain smoker, so it will produce activity related to P450 enzyme inducer. So maybe that may not show the effectivity at normal therapeutic concentration, because drug is metabolized quickly due to its enzyme induction activity, right? So in that person will have to give the dose above the normal dose, right? So we must keep this point in our mind. If a person who is a chain smoker and is not responding with any drug, right, at normal therapeutic levels, so we can think this point, because maybe due to his chain smoking habit, he has developed enzyme induction ability of P450 enzyme. So maybe this drug is metabolized earlier than a normal time period of time. So we'll have to increase the dose. So this is one of the important conceptual point that you must remember. Varenicline, which can be used in smoking cessation therapy, can may cause suicidal thoughts and vivid nightmares and mood changes, right? So these are the some side effects of varenicline. So that is why its use is not common as compared to we initially we prefer. First we say, okay, if you will apply your strong will, you can quit smoking. Okay, but if you are unable to quit smoking just using your will, then you can use nicotinic gums, right, or transdermal patches of nicotine. And even then, you are not going to stop that habit, then varenicline can be tried. Cocaine and adverse effects, anxiety reactions include hypertension, tachycardia, sweating, and paranoia because of irritability. It is taken with alcohol, right? So, but it will cause, if it is taken with alcohol, it may cause cardiotoxicity. Depression, addicts exhibit physical and emotional depression as well as agitation, which is treated with benzodiazepine or phenothiazine. Toxic effects can induce seizures as well as fatal cardiac arrhythmias. So antidote like IV lorazepam to control seizure can be used. That can occur due to hyperthermia, right? Sorry. Okay. Amphetamine adverse effects. CNS effects like insomnia, irritability, weakness, dizziness, tremors, and hyperactive reflexes, and also cause confusion, delirium, panic states, and suicidal tendencies. Serious related side effects: palpitation, cardiac arrhythmias, hypertension, anginal pain, and circulatory collapse. Headache, chills, and excessive sweating may also occur. Gastrointestinal related effects and abdominal cramping. These are the intestinal related side effects. Methylphenidate, GI-related effects are the most common: the pain, nausea, anorexia, as well as insomnia, nervousness, and fever. Increase the seizure frequency. So in patient with history of seizure should be avoided, and it should be contraindicated if a patient having a history of glaucoma. Now the second group, this we were discussing about the psychomotor stimulant. Okay, one important point I want to discuss, like amphetamine, that already we have discussed, and having different derivatives that are being used illegally, right? You might hear the name of a drug that is called the ecstasy. What is this ecstasy that is being used illegally? Anyone can tell me? Do you have any idea about ecstasy or ice? The term ice, okay, ice is being used, and we must stop this common practice that is increasing using ice in our youth community, right? Okay. Methamphetamine, right? And ice is basically the derivative of methamphetamine, right? So methamphetamine, that is also called speed, or which is a crystal form which is labeled as the crystal form, which can be smoked. That is called ice, right? So that is the methamphetamine. And ecstasy, basically again the derivative of amphetamine, and this is methylene dioxy methamphetamine, MDMA. This is also called ecstasy, and this can be used to improve the activity. And normally as illegal drug, this MDMA that is being used commonly, that is called ecstasy, and has a more selective action than amphetamine on the serotonin transporter in the CNS, and the drug is purported to facilitate interpersonal communication and act as a sexual enhancer, because positron emission Tomography studies of the brains of regular users of MDMA show a depletion of neurons, that is serotonergic tracts, right? So these are the important points related to this amphetamine. Okay, hallucinogens. I think there is a question. Okay, there is a question, sir. Repeat this again. One of the derivative of amphetamine, you know, the very commonly used term that we are using nowadays, use of ice is increasing in our youth, so we must take serious action against that. So basically this ice is the amphetamine compound that is called the methamphetamine, which is also called speed, and this is the crystal form that can be smoked, that is called the ice, right? And there is another derivative of amphetamine that is called the ecstasy. And fortunately, this is not being used commonly in our society, in our community, but abroad, in where the people who are going to nightclubs, and then they are using these compounds to enhance their activity, muscular activity, or uplift the mood, right? So this MDMA, basically methylene dioxymethamphetamine, MDMA, which is also called ecstasy, and that is being used commonly in different nightclubs. Okay, so now we discuss the hallucinogens. We have lysergic acid, diethylamide, LSD, and tetrahydrocannabinol, basically, which is derivative of marijuana. So this is the active compound that is present in the marijuana, basically, which is a grass form, and this tetrahydrocannabinoid is the active ingredient which is present in marijuana. Then phencyclidine. This is another very important substance, very dangerous substance, very dangerous drug, phencyclidine, that is also called, the street name of this illegal drug or illicit drug is the angel dust, right? And that is also being used illegally. Its use is being common, but the most dangerous hallucinogens, because the side effects are so severe of this phencyclidine. So lysergic acid diethylamide, which is also called LSD, and how it's going to produce its activity, inhibits the firing of 5-hydroxytryptamine containing neurons in the raphe, probably by stimulating 5-hydroxytryptamine to inhibitory autoreceptors on the cells. Tetrahydrocannabinol, endogenous cannabinoids in the CNS, which includes anandamide and 2-arachidonyl glycerol, are released postsynaptically and act as retrograde messenger to inhibit presynaptic release of conventional transmitter, including dopamine. Receptor cannabinoid 1 are the targets for exogenous cannabinoids present in marijuana. Phencyclidine antagonists at the glutamate and methyl D-aspartate receptors, analog of ketamine. You know, ketamine, in which condition, where we are using ketamine? Have you ever heard the name of this ketamine? Anyone? Okay, there is a reply. Analgesic, anesthetics, IV anesthetics, very good. And you know, one of the side effect of this ketamine is, one of the peculiar side effect of this is ketamine is the vivid dreams, right? Vivid dreams, or this is the hallucinogenic activity due to this phencyclidine, which is a very important property of this phencyclidine. Okay, pharmacological effects related to lysergic acid diethylamide, which is LSD, activation of sympathetic nervous system, pupillary dilatation, increase in blood pressure, piloerection, increase body temperature, induce hallucinations with brilliant colors, mood alteration also occurs. Tetrahydrocannabinol, feeling of being high with euphoric. So this is one of the reason of addiction of this compound, marijuana, disinhibition, uncontrollable laughter, changes in perception and achievements of dream-like state. Mental concentration may be difficult if a person is on tetrahydrocannabinoid. Vasodilatation occur and the pulse rate is increased. Habitual users show a reddened conjunctiva. Usually, in our society now, fortunately, this is not a common problem nowadays, and I think thanks to social media or media, they have highlighted the corrupted babas, right? Because some of the person says बाबा जो है वो जलाल में आ गए हैं, देखना बाबा के सामने कोई ऐसी बात नहीं करना, और बाबा जब आंख खोलते हैं तो उनकी आंखें सुर्ख होती हैं. व्हाट इज इट मींस? बाबा पर अभी जो है वो जिन आया हुआ है, शाहे जिन्नात आए हुए हैं, जिसकी वजह से आंखें जो है बाबा की लाल हो गई हैं, right? So some babas, they used to take this tetrahydrocannabinoids, marijuana commonly, right? And phencyclidine, pharmacological effect, most dangerous of the hallucinogenic agents. Psychotic reactions are common. Impaired judgment often leads to reckless behavior, right? Therapeutic use, lysergic acid diethylamide, no therapeutic use, no medicinal use, right? There is a term that we use, the controlled substances or controlled drugs. What do you mean by controlled drugs? There is a schedule for controlled substances or drug regulating by drug regulating authority. So how many schedules or classes of scheduled drug? How many classes we classify the scheduled drug or controlled substances? Anyone? Okay, this drug class belongs to class 1 scheduled drug. This drug belongs to class 2 scheduled drug. Okay, this drug belongs to schedule 3 drug, or this drug belongs to schedule 4 controlled drug. We have classified schedules of controlled drug classified into 4 classes: class 1, class 2, class 3, class 4. And schedule 1 controlled drugs, what is the criteria? No medical use and high addiction potential. High addiction potential. An example, heroin, LSD. So this LSD belongs to class 1 scheduled drug, having no therapeutic application. If anyone is using, that is the illegal use. LSD, mescaline, PCP. PCP means phencyclidine, or methamphetamine, or ecstasy, all the derivatives of amphetamine that already we have discussed, that belongs to in class scheduled 1 drug, right? That is legally not allowed and high addiction potential, right? In class 2 scheduled drug, okay, medicinal use is there, but also high addiction potential. So we are not going to use commonly like amphetamine that we are using clinically in ADHD or narcolepsy, because we know high drug abuse potential, like cocaine, like methylphenidate, short-acting barbiturates, or even opioids, right? That belongs to class schedule 2 drug, right? Class 3 or scheduled drug 3 is okay, medicinal use but moderate abuse potential, and class 4, medical use is there but low abuse potential. So these, like lysergic acid or compound, that belongs to class 1, in which there is no medical use. Clear? Okay, tetrahydrocannabinoid, dronabinol, this is the compound which is the derivative. What we have derived from this compound is indicated as an appetite stimulant for patients with AIDS who are losing weight. Also used for severe emesis caused by cancer. Cannabinoid type 1 receptor antagonist. Rimonabant is effective in the treatment of obesity and has been found to decrease appetite and body weight in humans. So these are the clinical application of tetrahydrocannabinoids. And you know, in this government, there was a time in which they are publicizing, okay, we are going to develop this cannabinoids related compounds in medical therapy. Phencyclidine has no therapeutic application and manufacture of the drug is illegal. This already we have discussed. Adverse effects of this lysergic acid diethylamide, hyperreflexia, nausea, muscular weakness, paresthesia. High dose causes long-lasting psychotic changes in susceptible individuals. Panic reactions, bad trips may also occur. Haloperidol, antipsychotic, one of the antipsychotic drug, and other neuroleptics can block the hallucinating actions because they are blocking the amin's activity, right? In tetrahydrocannabinoid related adverse effects produces euphoria, and this is one of the reasons of using as a illegal drug, followed by drowsiness and relaxation, adversely affecting short-term memory and mental activity, decrease muscle strength and impairs highly skilled motor activity, xerostomia, visual hallucinations, delusions, and enhancement of sensory activity, right? Phencyclidine, overdose with phencyclidine include both horizontal and vertical nystagmus, marked hypertension, seizures, which may be fatal. Intravenous diazepam or lorazepam can be used. So this is all about the CNS stimulants and hallucinogens. What we have discussed is the exam-oriented or important points that at least you know at this level. And again, as I usually say, that if anyone is interested to go through these topics, that a student can consult with Lippincott or Katzen book, right, for more detail. But at least these are the important points that you must know at least from your exam point of view, right? So thank you so much. Allah Hafiz.